Hi, my name is Prudy Knaak, and I'm going to read to you today, Let's Visit Mayo Clinic with Dr. Jack, and this is about a helping dog. So if you've heard about a service dog, you know about how dogs can be helpful while you're in the hospital. I don't want to be here. When is Grandpa going home? I held my mother's hand tight. We were walking down a long hall at the hospital. Grandpa was sick. Mama said there was something wrong with his heart, so they brought him to Mayo Clinic to find the answer to his problem. I was scared. I was sad. When we got to Grandpa's room, he smiled at me, but I could tell he was tired. I sat by his bed. People came and went. They wore different clothes and did different things to Grandpa and to the equipment around him. Grandpa slept most of the time. It seemed like a long time, and I fell asleep too. I awoke when someone knocked on the door. Dr. Jack is here for his 3 o'clock appointment, a woman said outside the door. I heard clickety-click-click on the tile floor. I looked down. Dr. Jack was coming into the room, but Dr. Jack was a dog. The lady picked up Dr. Jack and put him right into Grandpa's bed. Now Grandpa had a big smile. He talked to Dr. Jack and petted him. I came over to Grandpa's bed and petted Dr. Jack, too. The 3 of us had a great time together. After a while, the lady said, "We need to go now. Dr. Jack has to see a girl who is having surgery tomorrow." Grandpa waved as they left. He closed his eyes, and now he looked calm and happy. I followed the lady out of Grandpa's room. She stopped, turned, and smiled. She was holding Dr. Jack. She put him on the floor, and I knelt down to see him. People were going past us in the hallway. Dr. Jack held out his paw. I wanted to shake hands. Dr. Jack looked at me, cocked his head to one side. His eyes were sparkling. Did he wink at me? I shook his paw. "Glad to meet you," Dr. Jack said. "Your grandpa sure is a nice man. I can tell he likes animals." I stood up fast. "You can talk?" I asked with surprise. "Sure," said Dr. Jack. "I can do a lot of things. Here, scratch me behind the ears." That feels good. I try not to scratch myself when I'm with the patients. It's not professional. This was amazing. "Are you a real doctor?" I asked. "No," he said. "I'm a dog. Dr. Jack is my nickname, but I work with the doctors and the nurses and a lot of other people here at Mayo Clinic to help our patients. We're a team. My job is to help the patients relax and feel better and more at home." He thumped his tail when he said that. "Is this your first visit to Mayo Clinic?" asked Dr. Jack. I nodded. "Then I'll show you around. See the tag on my neck?" I looked at the tag. It had Mayo Clinic and a picture of 3 shields. "Those shields stand for what we do here every day," said Dr. Jack. "We take care of patients, people like your grandpa. We also do scientific research to find new ways of helping patients get better. And we teach, so there will always be trained people to take care of our patients. We've been doing these same 3 things for a long time. So go on, rub my tag." I nodded and rubbed Dr. Jack's tag. Then, before my eyes, the hospital changed. The people going around us were dressed in old-fashioned clothes. "This is St. Mary's Hospital, more than 100 years ago," said Dr. Jack. "See those men?" I looked down the hall and saw 2 young men. Dr. Jack explained, "That's Dr. Will and Dr. Charlie. They started Mayo Clinic. Their father was a doctor too. We had a tornado here in 1883 that was almost wiped out the town. But old Doc Mayo and his sons worked with the Sisters of St. Francis to take care of the people who got hurt. Later, the sisters built this hospital and became the nurses, and the Mayo brothers became the doctors. It got so busy that they had to bring in more people to help them. That's how our teamwork began. I was looking all around. Dr. Jack tapped me on his paw. "Time to go," he said. "Rub my tag again." Next thing I knew, we were high in the air. We were in a helicopter. Mayo Clinic has gotten a lot bigger over the years, said Dr. Jack. This helicopter is Mayo 1. We use it to get people who are sick or hurt and bring them to Mayo Clinic. Check out that view. We were flying over downtown Rochester, Minnesota. I saw tall buildings, beautiful ones, made of stone and glass. "Is that all Mayo Clinic?" I asked. "Most of it, yes," said Dr. Jack. "We help more than 1,000 patients a day. They come from 50 states and about 150 countries from around the world. About 10 million patients come here since the beginning of the days of the Mayo brothers." The helicopter flew on. We flew over farms and rolling hills. We landed by a hospital in a small town. I saw Mayo Clinic Health Systems on a sign by the door. There are lots of towns like this in Minnesota, as well as Iowa and Wisconsin, said Dr. Jack. People can see doctors near their home, but if they need special care, they can go to Mayo Clinic. He put his paw on my arm. "And you know what?" Dr. Jack said. "There are other places where Mayo Clinic is located, but they are too far away to take a helicopter ride. So rub my tag again." Now we were by a large fountain with water spraying downward. I saw palm trees and brightly colored flowers. "Welcome to Jacksonville, Florida," said Dr. Jack. Mayo came here in 1986, and about 20 years later, we built this hospital next to the clinic. Dr. Jack tapped me on his paw, and I knew it was time to rub that tag again. Next thing I knew, we were in the desert. Arizona is home to Mayo Clinic too, said Dr. Jack. "We've been here since 1987. Dr. Jack continued, "No matter where you go at Mayo Clinic, we'll take care of you. We have all different skills, and we work together and listen to our patients so we understand what they need." As we went along, Dr. Jack told me about 60,000 people work at Mayo Clinic. But there's only one dog like me, and then he thumped his tail as he said that. The trip continued. Dr. Jack took me to a doctor's office and an operating room. We saw people working together to help the patients. We went to a laboratory where people were finding new ways to take care of patients who were sick, and even to keep them from getting sick in the first place. In the simulation center, Dr. Jack showed me a mannequin that looked like a man whose heart was not working well. By practicing with this mannequin, we learned how to help people like your grandpa get better. Dr. Jack also showed me information about every patient in Mayo Clinic, even my grandpa, and it's all stored in a computer. Dr. Jack said, "When I see a patient, my name gets put into the computer too." He thumped his tail when he said that. Wherever we went, Minnesota, Florida, Arizona, I realized that Mayo Clinic is a big place. It was quiet and calm. Dr. Jack pointed to the colored lights outside the exam rooms. These colors have a code that tells us if a patient is waiting for the doctor or if a room is busy. That's one way to keep Mayo running smoothly, he said. And each time I rubbed his tag, Dr. Jack showed me interesting ways to spend time at Mayo Clinic. In Arizona, Dr. Jack and I went on a trail to explore the desert. In Florida, we saw a brilliantly colored chandelier. Nearby was a marble wall with water flowing gently down the stone surface. In Minnesota, a lady was playing the piano in a beautiful lobby. Jack joined her for some duets. Patients and employees stood near the piano singing along. Each time I rubbed his tag, Dr. Jack showed me interesting ways to spend time at Mayo Clinic. In Arizona, Dr. Jack and I went on a trail to explore the desert. In Florida, we saw a brilliantly colored chandelier. Nearby was a marble wall with water flowing gently down the stone surface. In Minnesota, a lady was playing the piano in a beautiful lobby. Dr. Jack joined her for some duets. Patients and employees stood near the piano singing along. Dr. Jack said, "Art and nature can help patients feel better." Dr. Jack took me to a marble wall that had a list of many names. "These people are part of our team at Mayo Clinic too," he said. "Their gifts let us have all these things that you've seen so that we can help patients like your grandpa. And speaking of your grandpa, I will come back to see him tomorrow. Right now I have to visit a girl who's having surgery. Why don't you rub my tag one more time?" I rubbed his tag, and there we were, back to where we started, in the hallway of a hospital just outside my grandpa's room. Dr. Jack was holding out his paw. We were shaking hands. I looked at Dr. Jack. He was just a regular dog. I mean, he wasn't talking now. But I knew that if he worked at Mayo Clinic, he sure wasn't ordinary. Had all this just happened in an instant? The lady came and picked up Dr. Jack. I watched her carry Dr. Jack down the hall. Just before they reached the girl's room, Dr. Jack turned around. He looked at me, cocked his head to the side, and his eyes were sparkling. Did he wink at me? I was glad that Grandpa was at Mayo Clinic, a place with answers and hope, where Dr. Jack and the team would take good care of him.